Hi, my name is Amaryllis. I'm a student physical therapist. Today we are going to be talking about how to properly dress a wound. We're going to start off by washing our hands. Wet our hands, apply some soap, clean in between our fingers on the bottom and tops of our hands. Scrub our palm and get the fingertips and under the nails, the thumb, and again the backs of our fingers. Make sure we clean off all the soap and some plain dry paper towels, which we can use to close the faucet. Okay, so today we are going to be dressing a wound on the bottom of a patient's foot. We are going to classify it as a Wagner 2 neuropathic ulcer. We know this based off of the location, which is the plantar aspect of the foot, and due to the callus rim that is surrounding the wound bed. Also, the Wagner 2 classification due to the exposed tendon that is visible in the wound bed as well. In order to dress this, because it is a minimally draining wound, we want to choose a dressing that donates some moisture to it to promote healing. So we are going to use an amorphous hydrogel and saline gauze and secure that in place with some rolled gauze. Now, in order to do this, we would start off by introducing ourselves to a patient. I would remove any dressing that they currently have in place, make sure that it is cleaned out properly, and start to apply the dressing. So what we could do is start off by gathering our materials on a sterile field. In order to properly open the field, want to make sure that we only touch the outer margins of the sterile field and lift quickly, discard the cover, and place it directly on our surface. Okay, now on the sterile field, we are going to apply a drop of our amorphous hydrogel. The tube can be set aside. We are going to place our gauze on here, which would be, for example, if the wound is smaller, some 2x2 woven gauze, or 4x4 if it is a larger wound. We would also have a bottle of saline, which we would use to moisten the gauze on the sterile field directly and place the bottle aside. Any applicator that we need for the amorphous hydrogel could be placed on here. And the rolled gauze and tape, since it won't be in direct contact with the wound bed, we can also place off of the sterile field. Now, the steps to dress this wound, we would use our clean applicator, grab some of the hydrogel and apply that to the wound bed. Careful not to get it on the edges of the wound where that callus rim is in order to prevent any maceration. On top of that, we would grab our moistened gauze, make sure to wring out any excess saline and apply that on top. A piece of dry gauze as well, and then use the rolled gauze to lock that ankle in place and secure it. Make sure that when the patient is dorsiflexing or plantar flexing their foot, that the dressing remains in place. We could secure that rolled gauze with some athletic tape. And then another important part of this dressing is to educate the patient on how to change it. Because it is gauze, we want frequent daily changes of the gauze. We will make sure that our patient knows if they are having any increasing drainage, or if they see any increased redness, swelling, increased temperature to the touch of surrounding that wound. Those are signs to look out for, in which they would need to contact a doctor, because these could be signs of infection. Now, the patient should also be managing their glucose, their blood sugar, in order to promote wound healing of this as well. They should know to do frequent foot inspections, because they are diabetic. If their sensation is absent on the bottom of their feet, they could be at greater risk for that wound worsening or obtaining another one. So again, frequent foot inspections, managing blood glucose, which they could see a nutritionist for, And then also we want to make sure that the patient offloads their foot. They don't put any pressure on that wound on the bottom of the foot. We could use a therapeutic cast walker, which will relieve the pressure on the forefoot and allow for frequent, the daily dressing changes that the gauze is gonna require. In order for the patient to also remain active, we are going to prescribe them aerobic exercise because they should not be putting any pressure on that foot. To remain offloaded, what we're going to prescribe is an arm bike exercise in order to promote circulation, and that will help with the wound healing as well as managing their, helping to control their blood glucose as well. Okay, thank you.